Plug and Play Abu Dhabi, we connect global startups with world-leading corporations and government entities to drive innovation.
My name is Sam Otson. I serve as the Chief Medical Officer at Sidekick, and I'm one of the two co-founders. My background is within research and medicine. I used to practice internal medicine and cardiology at one of Northern Europe's largest teaching hospitals in Sweden. And that's where the idea around Sidekick came about. Sidekick is a patient-centric platform for digital care and digital therapeutic programs. It's clinically validated, it's GDPR and HIPAA compliant, and it consists of patient support programs with remote patient monitoring features. And what's unique is that this is a platform that we have been able to scale to over 40 therapeutic areas. The tipping point for me when working as a medical doctor with people with cardiovascular disease was actually at the university hospital I was working at. So it was a typical day, and I had a patient at my office with cardiovascular disease that was just getting worse under my care. And I was doing my job, telling the patient, you know, if you don't adhere to your medication and improve your lifestyle, you will increase the likelihood of a new heart attack by X% within Y years. And I'll never forget this moment, because after the session, I looked outside the window and I saw the patient lighting a cigarette right outside of my office. My first reaction was obviously that I sunk down in my seat and I thought, you know, what are we doing here as medical doctors, trying to influence people's health behavior this way with zero effect. But then I realized that the patient was much more engaged with his smartphone than it was ever with me. And I knew we had to go digital. We are very happy to be part of the Future of Health program by Plug and Play in Abu Dhabi. And we see great opportunities when it comes to creating partnerships in the area. Because building on this foundation of having a proven track record of improving health outcomes and adherence, and the ability to build on that to create partnerships and engage key stakeholders in the ecosystem, like healthcare providers and insurers, to then generate synergies in the form of improving health outcomes, improving secondary prevention, and last but not least, creating value from the data with unique data insights that we can generate now that we have this unprecedented access to patients 24/7. Very exciting for us, a company originally from the Nordics, but now with offices both in Europe and the US. It's very exciting for us to explore the region from Abu Dhabi as a hub for our work. I would just advise that being an entrepreneur demands your full attention. It demands that you have a healthy lifestyle, and last but not least, it demands that you can assemble a good team. What I'd like to say is that the future is here. This disruption within healthcare has already begun, and I'm sharing this through the lens of a healthcare provider, having a previous career practicing internal medicine and cardiology, wearing a white coat. And it's also a race in a sense. The technology is moving very fast.